Kia ora koutou, Marky here. So if you're watching this video, you may be one of an elite few who have been given a direct link to it, or it's been passed on to you, or it's been shared in a group that you belong to, because this, although it's a YouTube video, is not one of the ones that I've made available to the public. And the reason you might be receiving this is if you are a doctor, particularly if you're a GP, counsellor or psychotherapist, or somebody that works in the helping professions, where you're in a position of trust where people might disclose things to you. That's why this video's come your way, and I hope you find it helpful. This video is aimed at an international audience, so some of the things that I'm talking about will vary from country to country or state to state, so I'll try and flag that when it arises, but please bear that in mind for the whole of the video. So I'm going to probably use the terms patient and client, probably interchangeably. If you work with people in a position of trust but you don't refer to them as patients or clients, please don't be offended. It's just a way of keeping things simple. Okay, so where do I fit into this picture? Why am I talking about this? Well, I am a psychotherapist, and among other things I have a couple of key specialist areas, but one of them is working with minor attracted people and harmful sexual behaviour and compulsive sexual behaviour. So I work with people who have done or might do things of a sexual nature which are harmful to themselves or others. I guess that captures everything. So that's why I have an interest in this and some expertise in this, and I can talk about it. Also means that I have a business interest in this, and my services are available. However, this is not going to be a hard sell. This is an information and educational video, and I will be putting in the description box other agencies and other people that you can go to for help. So it's not just about kind of trying to get work from this video, but if you want to send people my way, all well and good. So what would happen if you saw a patient or client one day and they disclosed to you that they had a sexual or romantic or both attraction to minors? Now when I say minors, I'm not talking about people that work underground, I'm talking about young people. Okay, so generally speaking, we're talking about people who are under the age of consent. Now this is one of these international things. The age of consent varies from country to country and state to state. This is one of those areas where there's the legality, the legal issues and the moral issues might not necessarily add up really. So I'm from the UK and I live in New Zealand, and the age of consent for both places is 16. Okay, so but other countries it's different. Some countries it's a higher age, some countries it's a lower age. So what we're talking about, I say minors because we could talk about children, but how do you define children? So minors are, I would say, for the purpose of this, it could be defined in different ways in different situations, but for the purposes of what I'm talking about here, people under the age of 16, or you might adapt that for the age of consent where you live. Excuse me. Now, the reason I don't say children as such is because minors consists of kind of two groups of people, if you like, the prepubescent and the pubescent stroke post-pubescent. And people can have a sexual attraction to both or either. So generally speaking, if it's prepubescent children, it's referred to as paedophilia, and if it's post-pubescent children, it's referred to as hebephilia. I think some people say hebephilia, some people say hebephilia. I say tomato, you say tomato. Also, if you're American, you'll say pedophilia, not paedophilia, and you'll spell it differently. But I can forgive you. So somebody says to you that they've got a sexual attraction to young people. What do? Don't panic. Okay, so a couple of myths that need to be busted right at the start is that although there's lots of misleading and confusing language in this whole field, and my battery is going on the device that I'm using. So I don't know why, because it's plugged in, so I just need to make an adjustment. So one of the key myths is that most sexual child abuse is perpetrated by paedophiles, where actually it's not. Okay, now that might be a bit mind-blowing, but I've done another video on that, so I'm not going to get too much into that. So actually most child sexual abuse is done by people that don't actually have an enduring and dominant or particularly strong sexual desire for children. Which is quite kind of scary, isn't it, really? So it turns everything on its head, and there's a strong likelihood that most people that have a sexual attraction to children don't ever act on it. I mean, we don't know because we can't get the research, we can't get the statistics, but people are trying. Research is being done among people that feel safe enough to come forward. Okay, so somebody expressing a sexual desire towards minors doesn't mean that they are a child molester or a sex offender. It doesn't mean that they are even necessarily a high risk to children. The fact that they are telling you about this and seeking help for it is a sign that their risk is on the lower side rather than on the higher side. If they were seriously interested in abusing children, then they wouldn't be telling you. Okay, so first thing is not to overreact and to get things into perspective. This could well be in front of you an extremely courageous person who has grown up and probably from puberty onwards has begun to recognise that they have an interest in children and young people, in minors. Now, where all this stuff gets medicalised, it doesn't actually help, actually. It confuses the issue, because if you look in the DSM, so for those of you who aren't doctors or in the psychological field, that's the Diagnostical Statistical Manual, which is one of the main diagnostic manuals that's used by doctors and psychiatrists and psychologists, clinical psychologists. And it changes all the time. They keep reissuing it, and they throw a whole bunch of diagnoses out and bring a whole bunch in and change the criteria for some of the ones that remain. And so paedophilia is defined in there as, I believe, an exclusive interest in children, and that's actually very rare. We sometimes call them pure paedophilia, pure paedophiles, if that kind of sounds like an oxymoron, but it can be very true. Most people, certainly most people that present to services that we're aware of, have a more varied sexual palette. So they might have a strong interest in minors, but they also will probably have some kind of interest in adults as well. They might be straight, gay, bisexual, pansexual, whatever it might be. Okay. So let's not get too hung up on the diagnostic criteria here. What we're talking about is if somebody discloses to you a worrying, or to them, a concerning and worrying sexual ideation, that's what we're talking about. Okay, so don't get hung up on whether it's exclusively towards children, or just dominant, or not even dominant but significant. That doesn't really matter. The person's talking to you and asking you for help because they want to do something about it, whatever it might be. Okay, so this is where you need to be aware of the laws in your country. Okay, as I said, all these things vary. So some countries, and it varies according to your profession as well. There's law and there's professional codes of ethics. So some countries' professional codes of ethics say they all cover basically when you disclose, when you have to legally when you have to disclose something that's been told to you confidentially in a client-patient setting, and when you don't. Okay, so check that in your country. But generally speaking, it's unlikely that the law of your country is going to require you to report somebody just for having a paedophilic or hebephilic ideation. And if they do, that's really bad, because it's going to drive everybody underground and no one's going to seek help. So if somebody discloses that they're harming somebody or they have harmed somebody, that's a different issue. And again, refer that to your code of ethics for your profession and the law of your land. for guidance around that. And obviously, there are often very good reasons to break confidentiality. Usually, I mean, most places, the rules about breaking confidentiality are if somebody, if the client or somebody else is at risk of harm to themselves or others. But we're talking really here about the situation where somebody's just talking about their ideation. Now they may have acted on their sexual ideation, or they may not. Okay, or they may have acted on it and tell you that they didn't, which would be kind of understandable from their point of view because they don't want to be jailed. If they tell you they didn't, then it's not your job to play detective. I think you have to take that at face value. What do you do? Okay, so first of all, I think the important thing is not to bear in mind that person is maybe not told anyone about this for the entirety of their life, and they're telling you they trust you, they respect you as a clinician, and they're seeking your help. So the way you react is really important. So it's important to kind of keep any knee-jerk emotional reactions in check. And then the second thing is to know where to refer that person to, and how they can, places where they can go to get help. Okay, now you can refer them to me, but there are two agencies that specialise in this, and they are called, one is Virtuous Paedophiles, sometimes known as VERPED, and I'll put a link to that down in the description box below, but you can find that easily online. And another one is Before You Act, which is spelled like letter B, number 4, letter U, ACT. And they're both agencies that provide really helpful information and support in various forms to people who are disclosing this kind of ideation. Okay. Now, something else to be aware of and to have up your sleeve, I guess, is sometimes there is a condition. I don't think you'll find this in the DSM, but it's a form of obsessive compulsive disorder called POCD, which is paedophilic or pedophilic obsessive compulsive disorder. Okay. Now this is one of the intrusive thought forms of OCD. So when we think about OCD, what tends to come to mind is compulsive washing of hands, compulsive counting, compulsive checking of the door, checking again and again. There's a kind of subset of a subspecies of OCD, which some people call puro, because it's around thought, so it's around the obsessions rather than the compulsions. I would challenge that a little bit, because I think it depends how you define compulsions. I think there's compulsions in there, but they're kind of inner compulsions usually. But in theory, I'm open to the possibility that you can have OCD without compulsions, and that's how a lot of people see it, and that's where the intrusive thought disorders come into this. So we've known about intrusive thought disorders for a long time. Intrusive thought. So I'll give you an example of a intrusive thought disorder. So intrusive thought disorders are always ego dystonic. Just to explain terminology, things that are ego syntonic are things that we like. Things that are ego dystonic are things that we don't like. Okay, so some compulsions are ego syntonic. So for example, I'm quite compulsive around food, and I enjoy my food. I haven't, it doesn't cause me great harm in my life. I remain kind of well, and my weight's reasonably in balance. I'm a little bit overweight at the moment for various lifestyle factors, but that will change. So if I get an urge to go out and buy myself a bag of sweets, or lollies as they call them here in New Zealand, that's not something I'm feeling bad about and wrestling with. I'm happy with that. So ego syntonic. Ego dystonic means that it goes against, it's uncomfortable. So ego is I, dystonic is negative. So it means you don't like it. Okay, so intrusive thoughts are always by nature ego dystonic. People don't like them. So the thoughts go against people's values. So for example, somebody that's generally speaking a fine upstanding citizen, never broken the law or been violent in their life, will walk through town and have a kind of a thought in their head that, you know, what if I get the urge to push people into the traffic? And these thoughts are really distressing, you know, because people kind of think, oh, well, maybe I'll do it, you know, and it's horrible. It's a nightmare condition. But the reality is, with this condition, they never do. So now I'll give you another example, just to add a bit more texture. So sometimes it can take the form of somebody's very religious. It can take the form of an intrusive thought, which is blasphemous. So they'll be sitting in church or synagogue, and they'll start to fear that they might shout out blasphemous things in the church, and they never do. People never act on these things. Now, what we've noticed in recent years is people are presenting with this condition, but with a fear that they might harm children sexually. So it's more like an anxiety. So again, somebody will be in town and they see a pram and think, well, what if maybe I'll abuse that baby. So I'm just flagging this because some people, inevitably, this will present itself to some of you watching this at some time. And sometimes it's been horribly mishandled. As an NHS, I believe it was NHS case, where a guy disclosed this to a clinician he was working with for some other issue, and ultimately he ended up losing his job. He ended up losing contact with his children because the clinician just overreacted and saw it as a risk issue when it wasn't a risk issue. Now, obviously, something to be considered, something to bring to supervision, bring to a team meeting, get some guidance on. And I'm not saying we just ignore it, but it's important to diagnose. If you're a doctor or a clinical psychologist, diagnosis in these situations is really important. So this person disclosing this sexual ideation to you that they're concerned about, it may not be real. It may actually be an intrusive thought disorder, an OCD, intrusive thought disorder. So I hope that's helpful, and I will put some useful links down below, and also please refer to me if you think I can be of help. I work internationally online, so I can see people anywhere in the world and work with this, and I have a lot of experience in working in this area. But this isn't a sales job really. I like to let people know what I do and make my services available, but the important thing is to get the right information out to people, and this is what this video is all about. I hope it was helpful. Thank you for watching. Thank you for sticking through to 18 minutes, and by all means get in touch with me if you have any questions or you want to discuss this further, and do check out the other videos. I've got other videos on related topics, so what I might do is put some of the links to that down below as well, so you can check those out. So thank you very much, and goodbye. Rangi Mario.